Welcome, everybody, to What's Cooking with Dr. Cook. We are having a doctor to doctor chat tonight with Dr. Ashlie Morrissey. Yay! Hello. And oh, here we go. And tonight we are going to talk about vitamin D and your health. So we have had some amazing content from our wonderful Dr. Ashlie Morrissey about vitamin D and when testing is necessary, as well as correlation and causation with obesity and vitamin D. So there's definitely a lot of really great information that we're going to be discussing because vitamin D is so much more than just sunshine, although I haven't been complaining lately. There's been some pretty good sunshine this summer for sure.
Yes, although it did start raining like just 5 minutes ago, but that's
Oh,
okay.
my blinds are closed. It's been raining a little bit lately here in where we are, but generally over the summer, it's been a good summer with the vitamin D for
Well,
sure.
you want to dive in?
I do. I do. I think before we get into the nitty gritty of, you know, who would be considered a good candidate for testing, why don't we just go ahead and, start talking about what exactly vitamin D is? Because I think a lot of people, when they think of vitamin D, they go ahead and think of, sunshine, and maybe they'll think about, you know, calcium, maybe, but there's just so much more to it.
Well, and that's the thing is, you know, we could take a deep dive into like the endocrinology side of vitamin D and all that, but let's kind of skim the surface and kind of get a better idea of what's going on there and how it's created in the body. And I'll throw out some $5 words, but like always with these words, just, you'll have heard them at least. And if you ever see them again, you can be like, Dr. Ashlie mentioned that once. But the thing that I think is, I've always thought was kind of strange about vitamin D is that we use the term vitamin D for multiple different chemical compounds that are slightly different based on their oxygen, their hydrogen, where they are sort of in the production process. And so the thing that's interesting, I guess, to me is that, it's not all the same because, so basically, like you mentioned, we can get vitamin D from sunshine, and that is one distinct sort of process in that we have this very common form of cholesterol in our skin. And here's one of those $5 words, but it's called 7-dehydrocholesterol. Just hear it, let it go, it exists. But what's key about that is that the UV radiation from the sun actually breaks that down into the pre-vitamin D molecule. And what's even more interesting, I think, in our bodies, because I think sometimes our bodies are just so neat in the way that they work, is that say you're getting some sun exposure and you're having this 7-dehydrocholesterol being broken down to this pre-vitamin D, this precursor. But if you start going over into too much UV, into too much radiation exposure, and I'm sorry, you may hear my dogs barking because the thunder is like, they're terrorized, I guess. It's coming in the house for them. But what can happen though, if you have that too much exposure, so we're talking, you're going past, I'm out in the sun 15, 20 minutes, I'm starting to get a little burnt, is that pre-vitamin D actually continues to be broken down. So the 7-dehydrocholesterol is broken down past the point of where it's going to be the precursor for vitamin D. It becomes, and once again, but lumisterol is one of the molecules. Tachysterol is another one. Those actually are, they form basically a sunscreen. Your body is trying to prevent further damage to itself by creating these molecules that act as a sunscreen. But when that happens, you're no longer going to be producing that precursor to vitamin D because you're no longer going to be effectively absorbing that UV radiation. And so that's why people are like, sunlight's great. But once again, and I know we use that term all the time, moderation, but it really is key because if you overshoot the mark and start getting burnt, your body has a built-in safety switch it'll flip it and it will say, okay, you know what, we've had enough. We're shutting this off for today. But then once you get that broken down and say it's going the way it's supposed to, you have that precursor for vitamin D, well, then it has to go to the liver. The liver has to cook it a little bit. And what the liver is doing is it gets an oxygen molecule, it gets some hydrogen molecules, and it becomes a chemical compound. Once again, it's called 25-hydroxy vitamin D. The rain's really coming down, sorry, or 25-OHD. Well, interestingly, that's what we usually test when we do a blood test for vitamin D deficiency. We are testing that 25-OHD. Now, here's kind of the interesting part, I think, is that that's really not the form. That's not the form of vitamin D our body uses. It still has to go to the kidneys to be worked on a little bit more. It gets another oxygen, some hydrogen, and then it becomes another 125 dihydroxy vitamin D, which is also known as calcitriol. At this point, it's actually considered an active hormone. It's going to work in our body. But if, say, we did just a 25-OHD blood test on someone, and that's the one that's between liver and kidney, then they could show they have a normal level, but they could be deficient in calcitriol if they have kidney disease. And so that's where sometimes we have to dig a little deeper and that's where we're going to talk some more about, symptoms of, vitamin D deficiency and what that might look like. And if you feel like your lab tests are showing, everything's okay, where you might want to dig a little deeper or talk about your provider. And then, of course, we have the way that we can ingest. And so we can ingest what's called ergocalciferol or vitamin D2. And so that is actually formed in plants or funguses, so mushrooms, not things that grow in your refrigerator. But because it's actually interesting, they can actually produce mushrooms with extremely high concentrations of the ergocalciferol because they can hyper-expose mushrooms to UV radiation. It's kind of really an interesting thing. However, the vitamin D3 is or cholecalciferol, is what's actually produced in our bodies as that, process from UV sun exposure in the skin. And also if you're eating like fatty fish, that's actually what you're going to get from that is the cholecalciferol. And so the general thought process and studies have shown is that if you're going to supplement vitamin D, to use the cholecalciferol and not the ergocalciferol. And a lot of times what you'll see on a shelf is vitamin D2 or vitamin D3 because that vitamin D3 is closer to what our body needs. It's basically, if we take the vitamin D2, we're going to have an extra step to break that down before our body can start to use it. And I don't like to make my body work more than it has to. So that's sort of in a nutshell, how we get calcitriol, which is that active hormone, which is actually what we're, the end result we're wanting. So, and like I said, sort of skimming the surface of endocrinology, but, there's a lot that goes into that, a lot you can deeper dive on that. But that's it in a nutshell.
One question that I have, when you're talking about the sun exposure for, 15 to 20 minutes, it seems like we have sunscreen in everything. We have sunscreen in our makeup. We have sunscreen in several lotions. So, where on the body would be the best place to maybe expose yourself during like the months where we don't have a lot of sun? And, would you recommend maybe holding off on putting anything on your body lotion wise until maybe you go out and just give yourself that vitamin D?
So yes, and of course that's always, sometimes in medicine, it's always this kind of weighing of risks versus benefits, because of course we want to prevent, we're always concerned about skin cancers and things like that. And so of course, we're always hitting the wearing sunscreen, daily sunscreen and your moisturizers, those kind of things. But if it, and so it does have to be something intentional that if you're feeling like you need more vitamin D synthesization, then you need to actually consciously make an effort to be out in the sun without a form of protection. I typically recommend, though, that people still wear sunscreen on their face. And, then they can have exposure on arms, legs. But I also mentioned to people, because I certainly have had a lot of people say, well, I drive all day, I have exposure in my car, or my office has a window and I get sun exposure in my office. That's not true, because all of our modern windows, automobile windshields, all of those actually have UV filtering properties. And so that does not count toward your UV exposure to help with vitamin D synthesis. It can be nice and feel great, but unless you have the one arm hanging out the window to get the UPS driver tan, then you're still just not going to be synthesizing the vitamin D. So does have to be something that's sort of a conscious decision of, okay, I want to get out, I want to get some sun. And during the winter months, and I think we have talked about the studies that have shown that above a certain latitude, the majority of people are vitamin D deficient during the winter months, because it is a conscious thing that you have to. And of course, that's where we can get into using things like UV lamps for a short period of time during the day. But you have to make sure that they have the UVB, which is what helps break down the vitamin, is breaking down the vitamin into vitamin D. I mean, so it's something though that is a conscious sort of choice. It's not something a lot of times that just happens. It's also worth mentioning that as we age, we just naturally have a reduction of the 7-dehydrocholesterol in our skin. And so that is something, just once again, to sort of think of, keep in mind that it's not going to be as effective to get sun exposure as we age, simply because that process just is not going to be as efficient. That it may be necessary to have more of the dietary or oral supplements with actually taking, a pill form of it, because your skin just is not quite up to doing what it used to do. No matter how many
Gotcha.
fillers and Botox we get, it just stops.
So true. We actually have a couple questions for you. So, is it necessary to stay within that 11 a.m. to 3 p.m. time frame to like efficiently absorb the vitamin D from the sun?
So that is the time when the sun is at its strongest. You're going to get, your direct overhead rays. But once again, you have to keep in mind that it is, say you were able to, if it's going to be easier for you to go out before work, after work, because I always say incorporate what works in your life. If it's not, possible for you to go out and, roll up your sleeves and roll up your pants legs and be outside for 20 minutes in the sun because you may have, work or something else. Okay, well then what can that look like? In the morning, evenings after work, how can you incorporate that? But that is the strongest time when the UV radiation, is the strongest. So you're going to get, I guess, the most bang for your buck at that time of day. But also, once again, keeping in mind that I would recommend still, using no more than what I was saying, like 15, 20 minutes, and using some type of skin, sunscreen, skin protectant on your face.
Gotcha. We have another question as well. So, what about not wearing sunglasses and getting it through your eyes?
No, I don't really recommend that. We don't have so our eyes are different, of course, than our like epidermis dermis structure. And then if we start getting frequent UV radiation exposure to our eyes, we can actually develop what's called a surfer eye, or it's called a pterygium, is once again the $5 word for that. And it's not something that really hurts you as far as increasing morbidity, mortality, but it's actually where your body will try to grow some new skin across the iris to protect it from UV radiation. And it's called surfer eye because those are the people we kind of first saw it and studied it in, because obviously most surfers aren't wearing sunglasses. So I do recommend, you're not going to get synthesis. For one thing, that's just such a small percentage of your body surface area. You don't have the 7-dehydrocholesterol in it, and you might wind up with something just kind of weird like a pterygium in your eye if you have increased sun exposure.
Right, right. We don't want the pterygium. No, no, definitely not. Well, if we if we're walking around and we're kind of contemplating that we might have a vitamin D deficiency, but we're not sure, could you kind of clarify what some of the symptoms are of vitamin D deficiency?
So, And this is where
There's
we
a
get.
lot. There's a lot. I read your article. I mean, we study it, of course, but like you threw out some extra, I feel like extra um
Sometimes.
symptoms that I just was like, "Oh my gosh, I did not know that those were symptoms." So,
And why, I think if you back up a little bit, and like I said, I don't want to get too deep into the endocrinology side of things, but the reason why vitamin D deficiency can affect so many different body systems and you can have so many symptoms of the deficiency is because um, what is called a vitamin D receptor, where that calcitriol goes and is active and does things. We think of the big things like, of course, bone, gland, certain glands, things. But what we've found is that these vitamin D receptors are actually present throughout most of the body. And so while it's not as well studied, we know that vitamin D has an effect on most body systems, even if it's not well understood. So that's where we get into muscle aches, bone pain, things like that. So those a lot of times are going to be due to changes in levels of calcium. And kind of at its most basic way of thinking of it is that vitamin D and calcium are often going to kind of go hand in hand, So, where one goes, the other may follow. And so you may find if you have low calcium levels, then along with a low vitamin D level, then you may have muscle cramping, muscle weakness. You can develop osteomalacia, which is like a pre-osteoporosis, where you just are starting to have your bone, your osteoneogenesis, like formation of new bone, is just not happening the way it's supposed to. So this is, pre-bad hip breaks, but you can have bone pain as part of that. We talk about like mental sluggishness, mental fogginess, not being able to think clearly, process information clearly. That's sometimes something people may find, but also mental health things. So we get into sort of that neurology, psychiatry side of things, and when it's affecting the brain, we may also see depression, mood swings. Fatigue is a big one that people may complain of, and so the fatigue may be multifactorial because the vitamin D can also or changes in your vitamin D levels can affect your sleep architecture. And so you may not be having, your sleep may be adequate as far as length of time, but your sleep quality may be poor. You may not be achieving the type of sleep, like the level of REM sleep that you need and those types of things to get really rejuvenated. Now, you may also actually find some insomnia, but a lot of times studies have shown it's more of that change in the sleep architecture that's causing the daytime fatigue. So, you could sleep 10, 12 hours, still feel tired the next day. And people may find changes in their hair texture, wounds don't heal the way they're supposed to. An interesting thing, some people may find they have sweating, particularly on the head, just excessive sweating on the scalp of the head. And this is kind of going back into how this is working on kind of our hair and all this stuff. But sometimes that can also be some other places on the body, but primarily you find it's the head. So we also, the big thing that we start getting into are cardiac risk factors. And so this is where you may see changes in high blood pressure, heart disease, or stroke, and find someone has a very low vitamin D level. And then, of course, weight gain and obesity are a whole nother, kind of big issue in and of themselves. And that's where you mentioned earlier, like the causation versus correlation. Because multiple studies show that obesity and low vitamin D levels, they go hand in hand. And so this is one of these things where then in medicine we say, okay, we see this is happening. Why? And so one theory is simply dilution. if you are obese, there is more volume to your body. And so you may actually, if you got rid of the adipose or obese tissue, then you may, and then that level, that amount of vitamin D was still in your body, it would actually be a normal level. However, more and more studies are looking at the fact that pre-obesity, looking at the development of obesity, that people have chronically low vitamin D levels. And so that's where it becomes interesting, because it's something that is seen as, is it correlation or is it causation? Or is it a little bit of both? And so, and that's something that goes into, I think, if you wanted to deeper dive into obesity as sort of an inflammatory process and things like that, because there's a huge correlation, also a huge body of research about vitamin D and autoimmune disorders. And so that's where we can get into things like multiple sclerosis, where we typically will keep people's vitamin D levels higher than we do the general population. And we know that people with lower vitamin D levels, there's a tendency to find that they have an increased risk of developing multiple sclerosis. And then we look at other types of things, like, what about other autoimmune diseases? What about like type 1 diabetes? Is there a protective property in keeping a vitamin D level normal? And this is where it becomes very interesting, because when we start looking at research studies, then there is a correlation between low vitamin D levels and all of these disease states. So we see that people who have low vitamin D levels are at increased risk of type 1 diabetes, of multiple sclerosis, of obesity, heart disease, heart attack, stroke, things like this. But where we get into some of these is that we cannot then turn around and do a controlled trial or research showing that if we supplement the vitamin D, that it in turn decreases the risk. And so that's where we get into why there are not such just, huge supports of, okay, let's keep our levels a little high. Although it is interesting, because we have our recommended daily allowance, and then we have other studies that have come out saying actually that should be higher. And so that's always kind of an interesting thing. We also can look at things like, and this is where when we get into kind of medical, that correlation versus causation. So, for example, like a study came out this year that showed that people who had and it was a huge meta-analysis that was utilizing data from the Department of Defense, because they have a huge kind of captive pool of people that they are always doing blood tests on consistently. So they found that people who had the Epstein-Barr virus actually have about a 32-time increased risk of developing multiple sclerosis. So then we know but it is not directly a cause of it, because not everyone who gets the Epstein-Barr virus has multiple sclerosis, but it is definitely enough to say there is some type of link there. It is not, though, it's not a 1 + 1 = 2. It's a 1 + 1 plus maybe some X, Y, Z factors we don't know yet equal that. But then I think what would be interesting to study is say, okay, we found a correlation between Epstein-Barr and multiple sclerosis. And what if we were to dose those people with vitamin D? Because that's where we can get into, all right, we have, what if that is a piece of that puzzle? What if, that, because that certainly could be part of that, okay, if we take someone who's had Epstein-Barr and a low vitamin D level, and, and perhaps, something else, then that can lead to multiple sclerosis. But I think that's where we can get into looking at, there's so many different avenues of research that I would love to see explored. But definitely, like for the muscle weakness, there are studies that show as we age, we have, increased risk of falls. We have, of course, decrease in muscle mass, just as a just one more way of joking with our bodies as we age every year. We just are losing muscle mass. And so there was a study done, and it was a fairly large study, and it showed that if we supplement people who are diagnosed with frailty or have had falls, and if we start supplementing them with a fairly high dose, but still within a reasonable limit of vitamin D, that there's actually a decreased incidence of falls. And so that gets to, okay, that's not directly related to bone density, those kind of things. But like I mentioned, if you have muscle weakness, muscle aches and pains, then that's an increased risk for falls. So there's so many ways that it can just get, it can get you.
Definitely, definitely. Because I think that, in your article, one of the meta-analysis that you mentioned, stated that obese individuals had a 35% higher rate of vitamin D deficiency than non-obese individuals. And, that's rather significant. I
So
also think it's, yeah, it's interesting that you mentioned the recommended dietary allowance because, it's, I want to say that it's 600 international units per day for 19 and up until you get to about 70, and then it's higher. But it's very rare that people actually meet that, through diet alone.
yes,
Um, because again, in order to actually reach your vitamin D intake, like well, they do fortify a lot. So, fortified dairy, fortified,
orange juice,
milk, orange juice,
grains, there are.
cereals. You definitely like those are the larger, sources besides fatty fish. The eggs are a good source, of course. You were talking about the mushrooms as well, but another thing with that is that people do have to consume calcium in order to absorb vitamin D. I mean, that there is that, like you said, hand in hand relationship. So I definitely think, like many vitamins and minerals, the quality of the Western diet, it does need much attention and much improvement because some of those risk factors that you speak of, especially falls, I mean, those do really impact the quality of life and mortality of individuals as they age, of course.
Yes, and talking about foods, because that is a frequent question. Is, and I'm always in favor of sort of the most conservative approach if it's not going to do harm. But so trying to talk to people about what food sources. And I always mention to people, because everyone seems to still have egg fear, that it is the yolk of the egg that they have to eat to get the vitamin D. But then
And
when you
that
start,
yolks are okay, but
the
people
yolks
still have
are
egg
okay.
fear. Okay.
That's the part that has the D in it. So, but also when you try to talk, a lot of people don't love fish. And then of course we once again have to get into worries about these larger fatty fishes, tuna, swordfish, some of those you're starting to worry about mercury and farming habit, so there's always all this, pieces to put into play. And of course no one ever has wanted to take cod liver oil. So, I mean, I don't, technically, yes, it's high in vitamin D.
Yeah. I will say that I did recently try sardines for the first time,
Yes,
and I thought they were pretty good.
yes, depending
Hmm.
on, I think, a few factors. Tasty. Of course, they can also be very high in sodium, so that's, it's always a toss up.
Yeah.
And then you get into like organ meats, which, like a beef liver, high in D, but once again, a hard sell for most people.
Yeah.
So that's where we get into, the supplements. Now, you mentioned, so we can buy vitamin D over the counter, and we can do that ourselves. Now, I always explain to people that you can't overdose on vitamin D through eating food or sunshine, but
Right.
you can become vitamin D toxic if you're taking too much of a supplement. And so that's where I think it's always important to think of, yes, there's sort of a recommended daily allowance. There's also sort of the tolerable upper limit of intake of where we think we might need to back off, because this being a fat soluble vitamin, if we take too much, it's not going to just change the color of our urine or feces. It could
Right.
have, we could become toxic from it. And so for and I actually wrote it down because it was
4,000.
4,000 for ages 9 and over.
Mm-hmm.
So, and it stays that way through the lifetime. Um, but that was something, that was the Endocrine Society that had that increased, I think it was about 10 years ago. Because before that, the upper limit was 1,000. And so or I think it was, or no, it was 2,000. They doubled it. Sorry, I misspoke. But yeah, so before that, we were kind of still, looking at these. 2,000 is that's the amount we're using in studies to see if it's beneficial. Below that, we're not seeing. And so, really, when you think about where we are with our limits and what we're recommending, but the thing that we worry about is if you become toxic, if you're overdosing, I guess, on a supplement. So, the what can happen is the big worry, or I guess the big thing that you would be concerned about, is if you become if you have hypercalcemia, because as we talked about, the D and the calcium, they're going together. And so if you become toxic from vitamin D, your calcium levels can be very elevated also. And so, okay, why is that a big deal? It's a big deal because it can cause you to have a heart attack or a stroke. And that's not anything anyone wants. And that's through sort of several mechanisms of action, one of which is it can actually just cause hardening of the vessels through that hypercalcemia. You may also, and this is not in any way, shape, or form a way to lose weight, but you may notice that you're losing weight. You have a distaste for food. People will describe just not having an appetite, that kind of thing. And so that can be another symptom of just your vitamin D level becoming too high. And that's where, even though it is available over the counter, I don't recommend people who have low levels, when we're trying to replace those levels and get them to a normal level. I don't recommend they're trying to take replacement levels of vitamin D over the counter, because you really should have those levels checked. And if you are taking an over the counter supplement, you should always mention that to your healthcare provider so that they can, just at your annual wellness check, do a vitamin D level and make sure that you are within a normal limit. Typically, if you're going to have a prescription for vitamin D, it's dosed very differently. A lot of times you'll receive 50,000 international units, and you take it once per week. Now, there are some studies that have shown that absorption, taking it that way, is not as beneficial as taking a high dose daily, because we get into how much our body can sort of break down, process, absorb, in this burst dosing schedule once a week. But that is still pretty much the standard of care. So you can always, and some people find that's difficult also to remember a once a week dosing if you are needing prescription supplementation. But that's, I think it's something you can always discuss with your healthcare provider, because you could break that 50,000 down into 7, divide that by 7 and take a little bit more than what is, you're still going to have a prescription amount that you're taking. So that's why you should still be monitored if you're having that amount of supplementation.
Yeah. Wow. Yeah. I mean, that's pretty significant, but of course that's a therapeutic, dose if you are deficient, And there was a question on the clarity about the tolerable upper level. And yes, it is 4,000 international units per day. And that's the maximum daily intake unlikely to cause any adverse health effects. Um,
And I always
and
say the
yeah,
caveat there is unless you have, undiagnosed liver or kidney issues, in which case that may become problematic. And also, you may know, people may notice it's typically dosed into international units, but it can be dosed, vitamin D supplementation can be dosed in micrograms. And so 800 international units is 25 micrograms, 4,000 international units is 100 micrograms.
100. Yeah.
So that's just something to think. And, it's typically going to be IU or international units when you look at a bottle. But every once in a while, I do come across, someone bringing in a bottle to the office and it will have, the micrograms instead of international units. And I have to quickly in my head go, okay, what was that again?
Yeah, I just looked at my B12's micrograms.
Yes.
Interesting. Yes,
So,
very
yeah.
interesting.
I think, I will say full disclosure. So I am a class 3 obese individual, and I have at baseline a significantly low vitamin D level. And I also have an autoimmune disease, type of asthma that is considered a type of autoimmune disease. And so I, even as and this is where I so think it's important to be an advocate for yourself, because even though I had so much research showing people with eosinophilic asthma have traditionally low vitamin D levels, obese individuals traditionally low vitamin D levels, and they're replacing those levels can help cut down on asthma exacerbations, and that that it can help overall with health. It still took me really kind of having to say, okay, hey, how about we do that and check that level, because I think this might be something that's going on. And so, I think it's something that if you look, and of course, like we discussed, those symptoms of deficiency, I mean, if you put those in WebMD, you probably have cancer, but that's true with
Yeah,
everything in WebMD. So, but that's a thing of also where I tell people, okay, if you don't want to have the conversation with your healthcare provider, but you're suspicious this may be going on, then okay, can you add some sun time in your day? Can you add some vitamin D rich foods into your diet? Can you add at least the daily recommended amount of a supplement into your supplements that you're taking maybe? And this is the part that's so frustrating, because no one likes to keep a symptom journal, but it's so important, because if you're feeling a certain kind of way and then you change and you're supplementing or you're trying to do certain things, then it's very important to have sort of that written, okay, I was having muscle pains and fatigue, and my symptoms were affecting this, and I was not able to do that, but after a month of this, I noticed these symptoms changed. And that can also help if you do have a healthcare provider that is a little bit resistant toward checking that level. And because this is where we get into, it's not even just insurance, but it's also that there's a question of, if you supplement the vitamin D level, is it actually going to help? That's still very much, I would not say, completely the approved sort of thought in medicine that, okay, we should supplement everyone who has a low vitamin D level. And so it's very important, anytime, and I know I've mentioned this before, but I'll continue saying this, but it's very important to be prepared and go in and be able to say, no, I've documented my symptoms and I have noticed, XYZ. When I made a change in my vitamin D intake, I now feel, ABC. And that can help you get labs done, if there is an issue. Because, for example, say you do have kidney disease that's undiagnosed or something, you may have, your body may not be able to use a vitamin D3 supplement or vitamin D2 supplement. You may have to take the actual hormone itself, which is the calcitriol, which is only available via prescription. But you're not going to know that unless you actually have, done some of this kind of footwork and figured out, okay, I think I may have this. And there is still some resistance to checking younger people for vitamin D deficiency. I mean, as we mentioned before, if you're above a certain latitude during the winter, you probably are mildly, vitamin D deficient. And so that's where, though, if you feel symptomatic, it's worth doing that so that you can be treated and you can hopefully become the best version of you. So
Yeah, isn't it 45 degrees latitude? So isn't that like Atlanta?
Atlanta. I
Yeah.
remember we had shared that one article, that one research article, and it was Atlanta when we had to
Yeah.
get a map out to figure out what latitude.
Right,
We're not
right.
sailors.
Yeah. It's just like,
So, but yeah,
hmm.
I mean but it's, once again, if you're symptomatic, okay, then it's worth investigating. Is it going to be beneficial to treat? And
Hmm.
so, risk versus benefit. What should we do here? But and of course, no one really gets rickets anymore. But I always tell people, in children, especially, that's why the vitamin, that's it still exists. People still get rickets, and that's where the children who don't get enough vitamin D actually have this very soft bone formation, and so that those are the very kind of out there things the vitamin D deficiency can cause. But
Yeah. I think one of the important things that, people need to know about vitamin D and taking supplements, though, you have to take it with fat.
yes, yes,
Have to take it with some fat
yes, that is important.
because it's
It
fat
being
soluble.
It is fat soluble. And so it is going to be absorbed and broken down. If you, and it doesn't have to, we're not talking you fried a pound of bacon and just, it can be a serving, which is just the tip of your thumb it's just a little bit of a carrier to kind of help get that
Mhm.
into your body and let your body start breaking it down so it can use it. So.
Definitely. Well, I think, Deanna, do you want to come up and and talk about your, yes, okay, cool.
I'm always up for talking. That
Yay.
could be a problem, but anyway. Um, can I come on? All
Yes,
right.
yes, yes.
What I have. Okay. So this is the supplement I have called. It's a liposomal. Have you heard of that before?
Well, I mean, if you're breaking down the root word, yes, I have. Yes, I've heard of lipo.
Okay. I think it's encapsulated in lipids, right? But this is what it has on
Yes.
the back of it. Hang on, I got to put my glasses on because I can't see. The aging. This is where I am in my life. I feel like your story, Ashley, and mine. I have asthma as an autoimmune. I've had it since I was a kid. I am dealing with, I don't know what stage I'm in, but definitely obese. I haven't been given a phase. I didn't know there were phases or stages. So there's that.
Stages.
And I am menopausal. So let's
We
just
take
put all the things in one soup mix. So anyway, this is says D3 as CHOLECALCIFEROL.
yes.
Okay. And that's the form. And then vitamin K2 is with it, which I think is some type of calcium, right? Is that what is
Uh,
K2? No, it's potassium.
Potassium.
What?
Potassium.
Okay. And that is in a form of MENAQUINONE 7.
Okay.
Okay. So that's the blend. And then, of course, the liposomal whatever to put it in the fat so I
Mhm.
don't get to eat bacon,
Yes.
which was so sad. So this is just a company as a health coach. The health practitioners can go through this. You guys should know. They're called Desbio. But anyway, I'm just wondering, does that sound like a good form? And again, and does the K2 help with absorption? Why is it with potassium?
I think I lost a few of your words in the middle of your question, but I think as far as the form, if that's like in a dropper and you kind of just drop it under your tongue, is that correct? Yes. So that is a good carrier form. Now, if you look inside of the capsule, say for example, a lot of these are going to be capsules. So most of these are, think of them like Advil liquid gels. They're already in a liposomal state. So you're getting an oil-based carrier for that. Now, the question is there enough? So even if you're taking, say, a capsule of like a 50,000 unit vitamin D, then it's still going to be inside that capsule in some type of a lipid-based or fat-based oil. And so it still is a good idea to take a little bit, like I said, just anything, a little peanut butter cracker, a little cheese, anything, just because it needs a little bit more than what the carrier fluid is. It's just not typically enough volume in a dose to kind of facilitate that metabolism. And then as far as so I know that there have been some studies looking at different forms of potassium. And so, from what I understand, now as far as putting them together, I don't know anything about those actually making it absorb better. But from what I understand, so the menaquinone 7, what you're talking about, the K2. So it has been in studies to be shown to be most effective in sort of the breaking down process of certain proteins. And so, particularly, I remember reading a study about a protein that's in the arterial walls. And so if you're talking about like arteriosclerosis, atherosclerosis, those kind of things. So that was one study that I had read about that specific formulation of potassium and why
I
it may
wonder if,
be beneficial.
and I'm wondering if that potassium is in there to help facilitate the calcium to break down and work together with it. Maybe it does something with calcium itself to
So,
help facilitate. I don't know. It's just interesting that that's the two things that are together.
yeah, so
I'll have to read why. Just take stuff.
Just take stuff. I like that.
so
You know.
it so that form of potassium, it does actually, in addition to like the effect it has on the arterial walls, it does actually have an effect on a specific part of our breaking down of bone, formation of bone. But I'm just not off the top of my head um, remembering what exactly it was doing for that. But I think probably what you're saying is correct. I mean, that sort of tracks that.
Yeah.
It would help perhaps if there is any issue with like a hypercalcemia, that it might help with some breaking down of some of those like osteocalcins, those kind of things, and the like arterial calcium there.
No, and my second question in this is probably a lot easier for you. Didn't mean to put that on you. Hey, do you know this form off the top of your head? I know you studied it. Anyway, so the other question is my olive complexion. So I have always kind of based my time in the sun and maybe that vitamin D reaction in that. I've always kind of based it on how long it took me to start getting just a little bit of change in color. I'm outside for 20 minutes, nothing changes. And I know that there is something to do with that, skin tone, melanin, right, in your
Yeah.
skin that just changes how easily you get your vitamin D. So How would you adjust for that?
And so that is once again, we get into that difficult kind of weighing of risk factors versus, because people who have increased amounts of melanin, which basically acts, so people who with increased forms of melanin, just so everyone's on the same page, correlates to a darker complexion. And at its most basic, of course, but that melanin acts as like a natural sunscreen essentially. And so studies have shown that people who have darker complexions, and this is like worldwide studies, so people in say sub-Saharan Africa have even though they have prolonged sun exposure, may have low vitamin D levels because of their increased melanin. So that's where you do, when we say 15 to 20 minutes, that is still okay. That's where we're getting into. If we go longer than that, are we going to increase our skin cancer risk? But if you do have, and that's why I think with vitamin D, it's important to think we can have sun exposure and we can synthesize vitamin D, and we can also have, dietary intake and get vitamin D. Because if your sun exposure is going to start creeping into prolonged periods of time without, sunscreen being necessary to synthesize the vitamin D, then it may be that the risk of skin cancers, those kinds of things, outweigh the benefit of synthesizing vitamin D in that way, and you may be better served by getting oral intake of vitamin D through foods or supplements or whatever the case may be. Because if you're darker complected, you are going to sort of reach this line of the return is not going to be equal to what you're having to risk.
Gotcha.
That makes sense.
Yes, yes, it does. And also you're saying basically with sunscreen that you really don't get any exposure to the sun that you need to be able to get the D. So you really kind of have to go it without sunscreen 15 or 20 minutes. That's the longest you want to risk. Everything else, take your vitamins, eat your fish.
Yes. Yes.
Okay,
Essentially.
I think I got it.
Okay. Yeah.
Definitely.
Have a little bacon with it. Okay, I got it.
Yep.
All
You
right,
got
thanks for
it.
answering those.
Awesome. Great seeing you.
Same.
Awesome. Yay. Well, I think Lily had mentioned that she uses the Nature's brand vitamin D supplements. I know that those are good, and so are the Nature's Made. So for
Yeah,
sure.
and that is the thing I always tell people with any form of supplement that's over the counter is, um, they're not regulated by the FDA.
Right. Right.
And so you want to typically use a brand that you can find their quality, their testing, their quality improvement kind of testing online. And it shouldn't be, you should be able to find it fairly easily. It's not typically going to be hidden. And making sure that it's, what is in their supplement, what kind of carriers are they using, what, every ingredient, kind of everything. Because it isn't regulated. And so, there unfortunately have been cases where people are taking a supplement and it can be way more than a listed dosage or not contain the what's listed on the label at all. And so that's where, supplements can become pricey, but I think that you can find reasonably priced ones that are from well-known brands. And that's just, the best thing. So you're not possibly just taking some, canola oil in a pill that someone's selling you as.
Yeah, definitely. During my internship, they actually did a study, and it was a well-known talk show host actually came out with a line of multivitamins and supplements, and when they went to analyze all of those, found that they only contained about 40 to 43% of the ingredients that were listed on them, because they're not regulated, and of course they stopped selling
Yeah,
them.
it's unfortunately very it's not uncommon. Let's just say that. So
Right.
it's always worth, if you're investing in your health and wellness, it's worth doing a little research. It might be worth not getting them at the $1.25 store and, spending a little more money. So
For sure. Well, thank you so much.
you're very welcome. It was a pleasure as always.
Absolutely. And thank you to the wonderful audience for joining us as well, and for all of your engagement and questions and comments. If well, actually, I would just highly suggest that you check out foodguides.com and check out Dr. Ashlie's writing. She's got some great stuff on vitamin D and some other topics as well. Always some fascinating stuff. Actually, a really cool article on nighttime interventions with GERD and acid reflux. Very cool stuff there as well. Love that article. So, and check us out on our socials at Food Guides Help. So, just look forward to seeing everybody again next week, and have a wonderful rest of your week. Thank you again.
Bye-bye.
Bye.